If you said to me at Christmas or just before that, Rosamond, by March we're going to have clean air, I would never have believed you. This is what I've always wanted, but sadly it's come at a very high price. The less cars there were on the road, to my surprise, the air got dramatically and very quickly better. I was surprised, happy, shocked at what a difference it's actually made.
Rosamond has campaigned for 6 years for cleaner air in London. In lockdown, one of Rosamond's aims came true when air pollution levels of nitrogen dioxide from road traffic halved in areas of central London.
The traffic-dominated pollutants like NOx and nitrogen dioxide have come down quite substantially, maximum reduction of around 50%. So it's been lovely to see clear skies. The one downside, of course, is that if one does begin to close off lanes on busy roads in cities like London, then there's a potential and a danger, a worry that one might increase congestion, which might actually make air pollution worse in some places.
Lucy and Leo live on a main road in Hackney. Leo has had pneumonia and asthma, which Lucy believes is a result of air pollution.
The health professionals have said that there is a very strong link between pneumonia and air pollution, and the fact that we live by a busy main road, and he goes to school and preschool at a school on a busy main road. It's quite likely that is why his lungs don't appear to be as strong as other people's.
It feels better without all the pollution.
For all of those people, breathing polluted air can make their symptoms worse and put them at risk of an attack or a flare-up. So if air pollution levels start to go up again, there's a real risk that people's symptoms will get worse, they could end up using their medication more, potentially even ending up in hospital as a result of that.
It's a bit worrying that people are encouraged not to use public transport at the moment, because in London we're just so used to that being our main mode of transport, or cycling. So I just hope lots of people, as things open up, don't jump in their cars and the main roads become really congested, and that could have a worse effect on children's health.
We need much wider action on not just traffic sources, and that means action on all sources: combustion, industry, commerce, residential heating, wood burning, and measures across Europe where other countries have to do their own reductions as well to improve air quality in the UK.
According to the Royal College of Physicians, each year in the UK around 40,000 deaths are attributable to outdoor air pollution. So what can London do to achieve cleaner air?
I'd like to see 3 measures. The first is massive investment to make it easier to do things which are not polluting. So easier to walk, cycle or work remotely. The second step is a much bigger, stronger and smarter ultra-low emission zone, which would take us down the path of banning diesel vehicles. And third, we need a new Clean Air Act from the government, which would give the mayor and local authorities the powers to tackle harmful emissions from buildings.
This isn't something we should only do for 6 months. I think we need to dramatically change our way of lives. My whole aim has been to raise awareness of the impact that air pollution is having on our daily lives.
We absolutely hope that the effect of coronavirus on our air quality will be a positive one. We know that people have really noticed the difference in air quality as we've had fewer cars and fewer vehicles on the road.
Post-lockdown, I'm hopeful that things will be better in the future.
It's a case of watch this space, I think. I mean, there is, as I say, the ambition to put a lot of research in place to unpick the details of how this has all worked. So we'll see in the future, I think, how there'll be lessons to be learned, of course.
Jem O'Reilly, BBC London.